While welcome to Serge for the Truth
Welcome back, TJ.
video podcast, man. You're an old pro now. You got the NBC thing going.
Oh, things are good.
I know things are really good, man. Actually a dream come true for us. We've been thinking about NBC for a long time, and it's been happening. And you come on every other week, and you come out all over the airwaves to 50 and 60,000 homes, and it's
Exciting.
an exciting time to be on television and stuff. So, but nothing's cooler than being in your own studio and talking about some of the real stuff, man.
Nutrition. I'm so excited to talk about that.
So before we got on here, and we were mentioning a little bit, the things that are real in our lives, which is cancer, and we all have people that we know have had cancer, and
Correct.
There's so many different forms of cancer. Now, I remember some Search for Truth ago, we mentioned why cancer has jumped so drastically over the past maybe 30 years, 25 to 30 years. And I remember us talking that a lot of it had to do with nutrition and the lack of, and the misconceptions and the myths of what people are still believing in. From the 70s, they still believe that fats are bad for you. And so they're loading up on carbs and sugar and the things that are evil. And, people are not taking good care of themselves. America is still obesely overweight, unfortunately. And I think what happens is we do a lot of nutrition at this office, but it's not what a lot of people think. I think a lot of people think, oh, well, you're a doctor in nutrition, a doctor of, alternative medicine, that, it's about weight loss and it's about, that's just a small part of it. It's supplements. That's just a small part of it. You're healing people with knowledge. You're pumping knowledge into their brain and giving them the truth. And that's why we're here.
And people get a bit confused when we say nutrition. We do nutrition. It's not just food, right? The goal with nutrition is to figure out what the body needs to allow itself to heal the problem.
There's the key word, heal.
So it's healing.
When I always talk to people about mind and body solutions and I always use the analogy, or I use the story of when you cut your arm, you get a little boo-boo, right? And you put a little hydrogen peroxide to clean it out, and you put your triple antibiotics on it. Within a week to 2 weeks, it heals itself on the outside. Well, with really good nutrition that you put in on the inside of your body, why can't your body heal itself on the inside of your body?
And that's a big misconception, or myth, I should say, that I had to talk this week with people, is they don't believe. I mean, for decades, we've been, I would say, brainwashed by the medical community to believe that there's nothing you can do when you have a condition. And they typically give you a pill, you have blood pressure, take your blood pressure pill, but the problem is still inside your body.
It's still there.
It's still there. It's never been addressed. So we look at the holistic point of view, meaning we look at the totality of the body. The medical doctors are trained to look at one part of the body, right? You go see a heart doctor, you go see a brain doctor, a liver doctor, a lung doctor. To me, it doesn't make sense because all those organs are all working together. If you have high blood pressure, for example, it may not be the heart the problem. And oftentimes, it's not the heart, it's the adrenals, or it could be a lack of potassium or magnesium. So the goal is to look at how the different parts of the body work together so we can restore the body back to normal function.
Right. You're getting to the why. You're getting to
the why. And getting back to the question you asked initially is the cancer. Okay, cancer is the big topic, right? Half of people today, unfortunately, struggle and will die from cancer.
They're going to develop it over time because of what they do to their body.
Exactly.
And
so cancer is 100% preventable. We can prevent it. Again, that's another misconception that if you have cancer, you have to go to your medical doctor and get a treatment, chemo, radiation, surgery, and that's it. There's nothing else you can do. But this is so wrong. I've had so many people over the years combat fighting cancer naturally. And sometimes we use other treatment as well to help the patient. And most people, I have to be honest, decide to do both natural and conventional because they are scared. They are scared to do natural to fight cancer because they've been programmed to do chemo, radiation, and surgeries.
Let's pump the poison in to kill the poison. And
exactly. And chemo, I don't know if you know the history of chemo drugs. Chemo drugs is a toxin, actually, a poison that they use during the Second War in Germany, during the Holocaust.
Okay.
So they will use those drugs to kill the Jews. So, and today they recycle those drugs as chemo.
Wow.
Chemo drugs. So those drugs are so toxic.
Yeah.
And most people do not survive chemo. They actually develop other cancers and other problems as they go during the treatment.
Right.
So today, the rate of survival from cancer, the conventional programs, treatments, is the same as 40, 50 years ago. We didn't make any progress. The same drugs, same treatment, the same rationale.
Now, correct me if I'm wrong, there is a time, and I know this when you do all of your health seminars. We do health seminars here every other week, and Dr. Serge will actually invite the public in so he can educate them, really, basically, and have a chance to talk to people one-on-one about their health history. But the point I wanted to get to is talk to me about those myths. And of course, I lost my train of thought, what I wanted to get into. But talk to me about the myths of cancer and some of the other things in life that, because, okay, here's what I actually wanted to say. Facebook, I was reading a post about a young lady who believes that ADHD is a real thing, and it's being diagnosed all the time. And I'm trying to keep everything in close to, there's cancer, there's aging, there's all these different things that we're throwing at each other because we're doing it to ourselves, basically. And you actually got into a little conversation with her about ADHD and it being reversible, and is it actually real? Is it something that's just made up in order to keep giving you pills? And and that's kind of really I wanted to bring the cancer into the direction of some of those other things that's being brought on to our kids and brought on to our.
Yes.
Could you explain a little bit about that?
Yeah, that's a really good point because there's so many myths out there and the people are so programmed to believe those myths, and they're programmed to believe that if you're labeled with this condition, like ADHD, you're stuck with this for the rest of your life.
Right.
You cannot do anything about
it. Are people too far along sometimes? And I know this is what I was going to get to with your health seminar.
Yes.
Are people, when they come in and you'll see them sitting in a chair, and they will say to you, Dr. Serge, I have cancer.
Yeah.
And you say to them, well, let me test you, but there could be a chance that you were just too far along for nutrition to help you. You're going to have to keep going the route of chemotherapy or whatever you've been doing. That was the point I wanted to make, but I did want to bring it into some of the other things that are out there that are kind of new over the last 15, 20 years that's being diagnosed on our kids and being diagnosed on, slow thyroids and things that are really happening to all of us.
Correct. To answer your first question is, yes, I have seen people coming to us and it was too far gone. For example, I had a woman years ago, she came to me with tumors, like 2 tumor masses in the brain. There's nothing we can do with this. Even medical doctors don't really know what to do with this. So there's some cases like that the disease is too far gone and we cannot bring the patients back to a normal function.
And unfortunately, you have your own personal history.
Yes.
With your own personal life and someone in
actually, that's how I got into nutrition. It's because back then, that was 15 years ago now, we had a son. He was diagnosed at 8 months old. He was diagnosed with a really rare type of adrenal cancer. So when we found out about that, the tumor took over the abdomen. It was the size of a football. He was a baby. So the tumor really took over everything, pushing the organs, the heart. So it was too far for him when we found out. And that's how I got into that, is that how can we prevent other parents, other kids to suffer from cancer?
Right.
And I got into nutrition. This is now my passion, is to help kids, because it's never too late, especially when it comes to kids, to help them. Mm-hmm. And getting back to your question of ADHD is, to me, my comment I made on Facebook is, it's the fake diagnosis.
Yeah.
I don't believe in this label. Yeah. It is a label, so there's no diagnosis for ADHD. You can talk to a doctor, and your doctor say, "Oh, your kid have ADHD," and you go see another doctor. Right. "Oh, your kid don't." So there's a lot of confusion. There's no protocol to evaluate if you have ADHD.
I mean, when we were growing up, I mean, you either were like a I should say maybe a mentally challenged, or
yes.
you weren't. There was nothing. There was nothing else. Everybody was different. Yeah, I used to read a sentence 9 times in a row, and I still didn't know what it meant. Because I couldn't concentrate.
Exactly, and most kids were labeled with ADHD. Boys, they are boys. Boys are just, they want to play. They
bounce around.
They bounce around. They have energy. They don't want to sit.
They pump those damn prescription into these little boys.
I mean, I see kids 4 or 5 years old taking medications for ADHD.
They're little boys, and you're pumping this stuff.
And you do, and those meds have never been tested for those kids. And kids are so young, and we don't know the side effects or the impacts of the brain development at that age. Oh, ADHD, it's relatively easy to fix. There's a few factors you need to consider. One is the diet.
Oh my gosh! Okay. Have you ever, you talked to that lady on Facebook, and my first question to her was, have you ever considered maybe diet? Have you ever considered maybe what you're putting in your mouth? For that little boy, is he eating too much sugar? Is that maybe what's going on?
Sugar.
What is his diet like?
Diet is the key, is the foundation. And most of the time when we tweak and change, optimize the diet, the ADHD goes away. That's why I say it's a fake label, because when you change the diet, you're not ADHD anymore. You can focus. Your brain works like it needs to.
Sure.
So we need to look at the sugar intake, right? The food dyes, also those colors that they put in those processed foods, that is known to cause hyperactivity. Then you need to look at gluten, milk, and it could be all kind of food sensitivities. I've seen kids being sensitive to strawberries, causing the hyperactivity. It could be tomatoes. It could be all kind of food that we need to find out.
Western medicine, and I'm not pointing finger at medical doctors, they do a great job. I mean, the medical doctors are trained, experts in their field, just like you are. You're a doctor, you're trained in your field. So I'm not pointing the finger at any of those, but Western medicine just seems to always dismiss that. They just said they just overlook the nutrition part and say they're not going to do the nutrition part right, so I'm not even going to bother mentioning that.
Yes.
We're just going to go ahead and get my script out, and I'm going to write you. And listen, I take prescriptions, that I'm working hard to try to get off of, so I'm not perfect. We all have our taboos. We all have our stuff.
Exactly.
That we've been trained to, well, if I feel this way, then I go to the doctor. He must be right because he's a doctor. So I'm just going to do what he tells me to do.
Exactly.
You're not telling anybody to do anything. You're just giving them supplements, which is food, which is nutrition, and say, go ahead and take it and see how it feels. There's no side effects to food.
No, there's no side effects.
This is just healthy food in a pill form. That's all it is. It's a supplement in a pill form.
Correct.
And then you come back and tell me how you feel over it.
Exactly.
We'll work with you over the next 6 months, and you just tell me how you feel. Listen, you didn't build this beautiful $1 million facility because what you've been doing is wrong.
I mean, that's the beauty of what I do, is it works every single time. You give nutrition to the body, and the body will heal itself.